Kuvan is used with changes in diet for the long-term treatment of a certain inherited disorder called phenylketonuria, PKU. It helps to remove a certain chemical called phenylalanine from the body, which can cause brain damage if there is too much of it. The daily dosage and optimal timing for taking Kuvan should be determined by your doctor based on your individual needs. Before taking Kuvan, make sure to read the patient information leaflet and instructions for use provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth with a meal as directed by your doctor, usually once daily. The dosage will be determined by your medical condition, age, weight, lab tests, and response to treatment. You can swallow the tablets whole or dissolve them in 120 to 240 milliliters of water or apple juice. To help the tablets dissolve faster, you may stir or crush them. Drink this mixture within 15 minutes and make sure to consume all of it. If you see small pieces of the tablet remaining in the cup, add some more water or apple juice to the cup and drink it so you get all of the dose. Another option is to crush the tablets and mix them in a small amount of soft food, such as apple sauce or pudding, and eat all of the mixture right away. Do not prepare a supply in advance. It's important to use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. If you do not get better or if you get worse, make sure to inform your doctor. If you experience a runny or stuffy nose or a sore throat while taking Kuvan, let your doctor know. It's important to remember that this medication has been prescribed to you because the benefit of taking it outweighs the risk of side effects. Many people who take Kuvan do not experience serious side effects. However, it's essential to contact your doctor right away if you notice any trouble swallowing, throat pain, persistent stomach or abdominal pain, unrelenting nausea or vomiting, black stools, blood in your vomit, or signs of hyperactivity. While very serious allergic reactions to Kuvan are rare, seek medical help immediately if you notice symptoms such as a rash, swelling or itching of the face, tongue or throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of potential side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. For those in the US, you can call your doctor for medical advice about side effects. Additionally, you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada at 1-866-234-2345. Always be sure to follow your doctor's instructions and take Kuvan at the recommended dosage and time. Before taking Kuvan, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have liver disease. If you are planning to have surgery, let your doctor or dentist know about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Kuvan should only be used when clearly needed. It is important to discuss the risks and benefits with your doctor. It is not known whether Kuvan passes into breast milk, so it is important to consult your doctor before breastfeeding. As for the daily dosage and optimal timing of Kuvan, it is best to follow your doctor's instructions. They will be able to provide specific guidance based on your individual needs and circumstances. When taking Kuvan, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medication dosage without first consulting your doctor. If someone has taken too much Kuvan and experiences severe symptoms like loss of consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It is important not to share Kuvan with others. Your doctor may also recommend regular lab tests to monitor your phenylalanine blood levels while taking this medication. Make sure to keep all of your medical and lab appointments and consult your doctor for more information. If a dose of Kuvan is missed, it should be taken as soon as remembered. However, if it is close to the time of the next scheduled dose, the missed dose should be skipped. It is important not to double the dose to make up for the missed one. When it comes to storing Kuvan, it's important to keep it at room temperature, away from light and moisture. It's also important to store it in a place that's not in the bathroom, and to keep it out of reach of children and pets. When it comes to getting rid of Kuvan, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, it's best to properly discard the product when it's expired or no longer needed. And if you're unsure of how to do this, it's a good idea to consult with your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.